We almost always have choices, and the better the choice, the more we will be in control of our lives. William Glasser. In recent years, the topic of stress has been featured in articles, books, TV and radio programs. Often these are accompanied by the different stress experts' reasons for why we are so stressed today. Because of the way we have structured our society, our lack of body awareness, and how we have forgotten to feel. These reasons are why we become stressed, some doctors, psychologists, and therapists seem to think. Only very few of these experts look at the metacognitive processes underlying the experience of stress, and how the stress sufferers overfocuses on their negative thoughts. Many professionals, such as psychologists, psychotherapists, stress experts and doctors agree that our attention can have an inward focus, that is, be directed toward our own thoughts, feelings and bodily sensations, or an outward focus, where our attention is directed towards things outside ourselves. But the metacognitive therapist will disagree with the therapist who believes that a stress sufferer lacks introspection, in other words, inward focus. In metacognitive theory, this excessive attention to your own thoughts, feelings, or bodily sensations is precisely what creates the problem. This excessive attention is not just a symptom of stress, as many seem to think. It is the cause. An inward focus takes up too much space and must be replaced to a much greater extent by an outward one. Meditation, long walks, music therapy and the like can all be helpful if they help the client. But using these interventions must be based on the understanding that metacognitive processes are what drive the client's stress response, and meditation, going for walks and the like only treat the symptoms. I see many stress sufferers trying to take action by following this advice. But this is not the type of action we are talking about in metacognitive therapy. If you have a lot of bills to pay or problems at your workplace that are stressing you out, going for a walk or noticing how you feel are not going to help you. There is no use in putting things on hold that require action. This principle also applies to the bigger decisions that need to be made. The problem is when worrying and ruminating, i.e. overthinking, take over, it becomes impossible to act. Here is where metacognitive therapy comes into the picture. In this relatively new method, which belongs to the third wave of cognitive behavioral therapies, has demonstrated quicker and more long-lasting results for clients with symptoms associated with depression and different forms of anxiety, such as generalized anxiety, social anxiety, OCD, and PTSD. This form of therapy is not the answer to every psychological disorder, but in the case of stress, this approach can most likely contribute to effective interventions. Stress sufferers spend an inordinate amount of time ruminating, analyzing, speculating, worrying, symptom checking, and threat monitoring, for example, which prevents them from taking action. Only when their excessive inward focus is significantly reduced can the client concentrate on the real problem and act on it. Treating stress with metacognitive therapy gives therapists, practitioners, and others who work with stress management an introduction to the metacognitive theory and method. This book is divided as follows. Chapter 1 is about the concept of stress. Chapter 2 gives a short introduction to metacognitive theory, along with some of its most important concepts and principles. Chapter 3 explains how the therapist works with the metacognitive method. Chapter 4 is an introduction to the subsequent 5 chapters, where each chapter is an example of a course of metacognitive therapy. The 5 characters in these examples are all an amalgamation of clients and client histories whom I have met and become acquainted with during the past several years. The point of including these client histories is to illustrate how metacognitive therapy can be applied in a tangible way. Therefore, these fictionalized stories represent the types of clients the therapist might meet in their practice or through their work. Any similarities to real individuals are not intentional. Along the way, you will find general reminders, suggestions for audio exercises, case summaries, and more in the Therapist's Toolbox sections. During my professional development as a psychologist, I have experienced that many courses, trainings, and books can elaborate well on a theory. However, when it concerns the practical part and how a theory can be applied, there is often a lack of examples. At best, you can read a few excerpts of a client-therapist dialogue. As an instructor, I also experienced the same thing. My course participants would like to see or read more details about what a whole course of therapy could look like. To help the therapist or practitioner who would like to apply the metacognitive approach in this book, I outline different courses of therapy and provide instructions, recommendations, and tools for the therapist. I am certain that this method can be applied in many ways. This is just my take on how you might apply it. This book presents the main features of this theory to the reader, who is then invited into the therapy room. This book should not be considered as training in itself, but rather as a supplement to a training in metacognitive therapy. By disseminating the metacognitive method, my hope is to help a large number of the many stress sufferers we meet today, quickly, gently, and sustainably. Linda Burlan Sørensen, MSc Licensed Clinical Psychologist, Board Certified Specialist in Psychotherapy and Supervision.